not gender. It's spreading in North Tulsa, South Tulsa, East Tulsa, West Tulsa, Midtown, and all of our surrounding communities. Everyone should wash their hands with soap and water as much as possible. Use hand sanitizer with at least 60% alcohol if soap and water are not accessible to you. A lot of people have asked me if they should wear gloves in public, and in all honesty, gloves are no substitute for washing your hands. Leave your gloves at home. Save them in case someone in your household becomes sick. You'll need to wear gloves when handling items a sick person has used, such as their dishes, laundry, and other household items. Thoroughly clean and disinfect your home using the guidance available on the THD website. Stay home as much as possible. Tulsa County contains thousands of essential employees who must go to work in order to maintain essential functions that employees do. We're asking everyone to do their part. Those who are critical to our community, please come to work. Those who aren't, please remain home as much as possible. I want to remind every business that remains open to continually review your protocols to ensure you are implementing safety measures. These measures should include additional cleaning processes, screening your employees for symptoms, reviewing your leave policies to ensure that staff can remain home when symptomatic or caring for a family member that is symptomatic, and limiting the number of people in your facility in close contact. I applaud local businesses who have implemented measures such as limiting the number of shoppers in the facility and the creativity of our local food establishments to remain open for curbside and takeout. Cover your mouth and nose with a cloth face cover when around others. This is my cloth face cover. You could spread COVID-19 to others even if you do not feel sick. Per the CDC guidelines, everyone should wear a cloth face cover when they have to go out in public, for example, to go to the grocery store or to pick up other necessities. Cloth face coverings should not be placed on young children under the age of 2, or anyone who has trouble breathing, or is unconscious, incapacitated, or otherwise unable to remove it without assistance. The cloth face cover is meant to protect other people in case you are infected. Do not use a face mask. These are critical supplies that should be reserved for healthcare workers and first responders. Visit our website for instructions and a video tutorial to learn how to make your own cloth face covering from items you have at home. Continue to keep about 6 feet between yourself and others. The cloth face cover is not a substitute for social distancing. All these measures are put in place in order to slow the spread and flatten the curve. We will get through this together, but it's going to take all of us coming together to stay apart. And we have to continue to everyone in Tulsa County to do their part and stay apart. Thank you. I'd like to introduce Mayor Bynum.
Thank you, Dr. Dart. I honestly couldn't believe it when he just said it's been a month and a day. It feels like it's been about a year. I want to remind folks one of the, I think, most valuable things that we can provide at these briefings is information and access to information so that you can make informed decisions to protect the people you care about. And a handful of what I've found to be the best resources out there would be, number one, the Tulsa Health Department's website. In particular, they have a landing page for this particular event. You can go to that. You can see all the latest information on the number of people diagnosed, a lot of other information relative to COVID-19, as well as the latest best practices to keep yourself and your family safe. So I highly recommend a visit to the Tulsa Health Department website. Second, our City of Tulsa website, cityoftulsa.org. If you go to that, you'll see a bar flash up at the top for the COVID-19 resource page. You can go on that, and it has links to just about everything that I, as the mayor, would be reviewing or have access to make decisions on this event. All of the legal documents, all of the latest data portals, everything that we've talked about at these to date, as far as the data sources are concerned, you can go to that page and access those yourself. The last one is the website, and you can find this on the cityoftulsa.org website as well and click through to it, tulsaresponds.org. That is the site for business owners to access very quick, immediate, no interest loans for you to tide you over until the much larger federal funding becomes available for our local business owners to tap into to get through this event. There are a lot of websites out there that are very valuable, but those are three that I find myself going to with a lot of frequency. Considering the fact that you can't help but pause and think about a month ago when we knew that there was one person in our whole city who had been diagnosed with this virus, this disease, and it still, for a lot of us, seemed like something that was happening in other cities and other countries, something we read about on the news. And now, a month later, this is something where we see our friends on social media who have it. Every day now, it feels like there's a new heartbreaking story about a wonderful person in our community who's passed away as a result of it. I do want people who have this, who might happen to be seeing this briefing today, if it's today or if you see a recording of it later, to know how much support the people of Tulsa have for you, that you have a community here that is rallying behind you in a way that it has never rallied behind anything ever before. And I hope that you can feel that as you're going through this, both for the people who have it and for their loved ones who are either caring for them at home or who are isolated from them because they're in the hospital. Please know that the people in this city care about you, and we're doing everything that we can as a community to keep our healthcare infrastructure in a place that you can get the healthcare services that you need to get through this and get back on your feet. To everybody in our community who's doing that sacrificing, I think at these press conferences, a lot of the time we talk about all the bad things that are happening, and rightfully so, because there are a lot of bad things happening as a result of this event. But I also think it's worth pointing out that I cannot think of any instance not just in the history of Tulsa, and you all know I love Tulsa history, but in the history of Tulsa, in Oklahoma, in the United States, in human history, I cannot think of a time where all people around the globe have in unison made a decision that we're going to slow our own economies down and we are all going to sacrifice to protect the most vulnerable humans around the world. It's the most extraordinary humanitarian response to something that I can think of in the history of humankind. And a lot of the time when we talk about humanitarian responses, we talk about it as, governments going to a foreign country or philanthropists doing something or nonprofits doing something. In this case, every person is doing it. Every person is playing a part in this response. Every person is making a sacrifice. Every person is doing what they can to maintain that kind of distance that allows our healthcare system to operate. And I'm so grateful as a mayor of Tulsa that so far the things that we've put in place over the last month, and when I say we, I don't talk about the government, I'm talking about we as Tulsans and in the Tulsa metro. The things that we've done in the last month that we've put in place are allowing our hospital system right now to not be overwhelmed, to be working the way it's supposed to be treating those who need it and getting care to those who need it most. So I'm just so grateful to everybody in our city who has decided to take this seriously over the last month and has made extraordinary sacrifices from the youngest amongst us to the oldest to protect our neighbors. It's extraordinary. As we move forward, I think the greatest threat we face is complacency. It's getting, feeling like this is the new normal and that we can revert back to the way things were. What I would ask is that we continue to focus on the things that we can control. And, in Tulsa, we really try to focus on those three big things. One, maintaining that social distance. That is what's allowing our hospital and our healthcare system to work the way it's supposed to right now. And if we want to keep that in place to keep protecting our neighbors, then we have to keep maintaining social distance. 2, support local businesses to the greatest extent that you financially can. Every day, if you can afford it, please buy something from a local business. The more that we can keep those dollars in our local economy, the more it helps our businesses in Tulsa get through this. And 3rd, please think about ways that you can share your hope and be a light to the people that you care about. It's one of I've heard from a lot of pastors over the last couple weeks and been moved to hear them talk about what they've seen in their own neighborhoods as far as parents spending time with their kids, being out in the yard with their kids, people reaching out to loved ones doing whether it's FaceTime or some other type of video chat with someone in their family or people they care about that they might not have been talking to it with such frequency before. But having this shared experience for all of us as people has raised that awareness of how important the people that we love are in our lives, and it's creating opportunities, I think, for each of us to reach out and share a little bit of hope with the people that we care about. So I really want to thank everyone in Tulsa who's doing the right thing right now to protect our neighbors. You're the heroes of this event. And will be recognized, I think, historically for having sacrificed in unprecedented ways so that people can get the medical treatment that they need. And now I'd like to turn it over to a great partner of mine, County Commissioner Karen Keith.
Thank you, and thank you, Mayor, for your leadership and your inspiration in helping us get through this. I cannot say enough about you. You know, as you followed these press briefings, you've all seen Glenna Cooper. She's right here with us, sharing information for the hearing impaired. And I wanted to acknowledge and thank Glenna and KT Laughlin, she's sitting here helping her, for stepping up during this time. Now, nationally, April is Child Abuse Awareness and Prevention Month, and the District Attorney Steve Kunzweiler wants to express concern for the safety of children during the COVID-19 pandemic. And this concern is backed up by Healthy Minds policy report that warns as many as 30% of children involved in quarantines could experience post-traumatic stress disorder. Unemployment and financial stress may also lead to more than 13,000 additional Oklahomans developing substance abuse issues. Now, if domestic abuse is a problem for you, please remember to call the Family Safety Center or DVIS, Domestic Violence Intervention Services. They have staff who can assist you, but do not just show up there. If you need help for any of these problems, call 211. They can direct you to the best agency. And for mental health issues, call the Mental Health Assistance Center. That's 918-585-1213 if you or a loved one is experiencing problems. Now it's time to fill out the once in every 10-year census. It's important that we are all counted. So I'm asking each and every one of you, if you haven't completed the census, please do so. It is really, really easy. It'll take just 5 minutes to ensure that everyone in Tulsa County and all of our communities are represented. The results of the census determine how hundreds of billions of dollars in public funds are allocated for public services like hospitals, emergency services, schools, highways, and bridges, and that's for the next 10 years. For every missed individual, that's about $1,700 that will not be sent to local governments for these vital public projects. And right now, Tulsa has only a 41.5% participation rate compared to Oklahoma City's 44.8%. So take just 5 minutes to complete the census at 2020census.gov. And don't forget the mayor's challenge between Oklahoma City and Tulsa. Let's get those censuses done. I also want to reiterate the availability of the Tulsa Regional Chamber to help our local small businesses throughout the entire Tulsa metropolitan area. They have numerous resources to take advantage of the $2 trillion federal CARES Act, including the Paycheck Protection Program. Small businesses and sole proprietorships could start applying last Friday. Independent contractors and those who are self-employed can begin applying this Friday. There are area banks like VAST, First Oklahoma, Arvest, and Blue Sky who are also helping applicants. So please take advantage of these resources and don't forget about what the City of Tulsa is doing to also help you in that area. As those $1,200 economic impact payments start coming in, we all need to be aware of who is asking for information and what they're asking. The IRS is already seeing a wave of new and evolving phishing schemes against taxpayers. So I want to remind everyone that the IRS will deposit payments into direct deposit accounts previously provided on tax returns. Now, taxpayers who did not list direct deposit information can use a secure portal on irs.gov, and that'll be open in mid-April. If the IRS does not have a taxpayer's direct deposit information, a check will be mailed to the address on file. And retirees who don't normally have a requirement to file a tax return, no action is required to receive their payment. The IRS will send those automatically. And remember, no one from the IRS will reach out by phone, email, mail, or in person asking for any kind of information for you to receive your payment. As a general rule, never, ever give out your pertinent personal information to anyone you don't know over the phone. Now, here's some ways you can help. This pandemic has dramatically impacted blood donations. So on Thursday this week, the OSU Medicine Healthcare Center is hosting a blood drive to assist with donations. It will be held from 10 a.m. to 3 p.m. at 2345 Southwest Boulevard. Visit yourbloodinstitute.org to make an appointment. You can also call 1-800-RED Cross to schedule an appointment to donate to the Red Cross Blood Bank. Now, last Friday, I had the honor of helping deliver some Meals on Wheels. The regular drivers, they're senior citizens, and they can no longer do the routes. But if you're young and healthy and would like to help out with Meals on Wheels, you're going to meet some wonderful folks. You have to do the social distancing and do everything to stay safe. But boy, if you can volunteer and help Meals on Wheels, that would be absolutely wonderful. Lastly, I want to take a moment again to thank all of our healthcare and first responders. In addition, some unsung heroes are grocery clerks, construction workers, truck drivers, and delivery personnel who are keeping the wheels turning, fixing roads, delivering essential supplies, and making sure life, when we get back to it, is ready so we can all hit the ground running. Your work is truly essential. So thank you all for continuing to do your part. Now for the rest of us. Let's do ours. Let's stay home and let's keep others safe. Now I'd like to introduce EMSA's President and CEO, Jim Wenham. Thank you.
Good afternoon. Thank you, Commissioner Keith, and I also like to thank Mayor Bynum for his leadership throughout this. And I want to speak to you a little bit about EMSA in the Tulsa area. I think the stay home request by Mayor Bynum and the city has worked out very well. We need to all practice that. We have noticed a decrease in our call volume of about 30 to 40 calls per day, which is fairly significant for our area. So we think it's working, and we know that's very important, and we'd like to reiterate that stay at home if at all possible. We understand there's some essential trips you have to take, but please, if you can, stay at home. We have over 300 employees here in Tulsa. Currently, we have 4 that are quarantined, that are asymptomatic, that we're keeping an eye on, and we have 1 that tested positive that is showing no signs, but has not been to work and is being looked after by medical care professionals. Every day, as we run calls, we take the ultimate precaution to keep not only the public safe, but our medics safe. We're constantly looking at ways to disinfect our vehicles. We're working very closely with the Tulsa Fire Department, and they offered up some new on-the-go type disinfectants that we're going to start in the next couple of days. We do disinfect after every call. We do disinfect when the crew comes in from the end of their shift, and again before it goes out. So we're doing multiple different times of disinfecting our equipment and the ambulance itself. In addition, our medics that come on, when they come on duty, they are screened. Their temperature is taken. They go through a quick review of their medical, make sure that they're okay, and then they're allowed to go on to go into service. And then at the end of their shift, they're screened again also. You'll also see our medics wearing lots of PPE, and sometimes you may not be in that type of situation, or you may not be a COVID type situation, but they still may be wearing PPE. That is to protect you and our medics. So that's going to happen throughout here. As far as our stockpile of PPE, our contractor has a national stockpile of it. We have plenty of PPE that lasts us into the foreseeable future, at least 2 months here in Tulsa, if not more at last count. We look at that every day. We have a running count. We keep a burn count of how much we're using, and we know any moment and any time how much PPE that we have. We're also looking at some alternative means of transportation, such as maybe BLS cars if a pandemic or if a lot of calls came in, so we have plans for that. And our main job is to keep our patients safe and to keep our crews safe. And I'd just like a shout out to everybody in the field that's working, all the first responders, Tulsa Police Department, Tulsa Fire Department, EMSA, Tulsa County Sheriff. Everybody is working very closely together, collaboratively, and we call this the Oklahoma way. So in closing, please stay home, please take care of yourself, and I'd like to call Dr. Dart back up to answer any questions you may have and close out this session. Thank you.
Thank you, everyone. And you heard some wonderful, inspiring messages today. And I hope you take those messages to heart and you follow directions and you continue to stay home. So if we can answer any questions.
From OETA, how are the Tulsa area nursing homes and senior care facilities holding up? Are there any significant concerns or outbreaks? And if so, can you tell us where?
So we don't really want to get into the where. We know that long-term care facilities, nursing facilities, all have patients who are at risk for greater illness. And of course, nursing homes in Tulsa and Tulsa County have been affected, like you've read about other nursing homes across the country. And we're working very closely with these facilities. The state has issued guidelines. We'll be continuing to issue guidelines to ensure that not only are residents safe, but those who work there are safe as well.
Okay, from Fox 23, is there some concern that the rush for face masks could lead to an even bigger lack of PPE for local healthcare workers?
You know, there's always that concern, and that's why in my remarks I really talk about fashioning yourself a cloth face mask. And when I say cloth face cover, that's different than face mask. And if people want to protect themselves and protect those around them, make yourself a cloth face cover. Go to our website, it'll show you how to do it at Tulsa Health Department. If people continue to use face masks when they're not in the healthcare setting, it definitely is going to put our first responders, our healthcare providers at risk for not having the equipment they need.
From Fox 23, of the 20 people who are previously reported as recovered, has their blood been collected so their antibodies could be studied? Is THD collecting blood from recovered cases?
Not yet, but that is the plan down the road. We're still in the early stages of response. We haven't, and we've talked about, been talking with the state about how to create a process and logistics to start to collect this blood, especially for plasma centers. So it's in the works, and it'll be implemented at really when it's time.
From Channel 8, we are seeing hospitals and clinics furloughing medical professionals. Is it the same in private practice? Closed offices, lost jobs. How bad is it going to get for our medical community beyond those actually fighting the virus?
You know, I think you can add those businesses to any business that's had to furlough employees because of COVID-19. So they're facing it, and I think doing the best they can to keep their operations viable so they can continue to serve the public and maintain their infrastructure so they can do that. So that I know business had to make hard decisions, just like we have in the city and the county, and applaud them for doing the right thing to meet their mission's needs and also allow the facility to do what it is they do. So it's a long road yet. We're going to see more of this probably before we see less, but it's what we have to do to eventually overcome this virus, and we are going to overcome this virus. So I applaud all the hard decisions that have been made, and there'll be more coming, but it's the right thing, and when you do the right thing happens.
Okay, from Channel 6, today was the highest number of deaths in the state to date, which includes younger patients. Any reason for that? And do you anticipate it will get worse?
You know, we've been saying all along that no one is immune to this, and even though some demographics have shown to maybe have a milder presentation, anybody can get sick. As I said earlier, there's no boundaries, and the virus is showing that to us, and it's playing out how researchers thought it might. So, not happy about it, not surprised by it, and as long as people do not social distance, this will definitely get worse before it gets better.
Okay, Channel 2, what is being done to collect demographic information on who is testing positive for COVID-19 and where they live in our city, and who has access to that information?
The health department, for every positive case we get, we conduct an epidemiological investigation and do back tracing to determine where that individual had been, so that if there was risk, we can identify that risk and then notify those who might be at risk. So the health department is doing that. Health department has that information. It's not information we would release because of HIPAA concerns and privacy concerns, but we do have it, and we are aware of where those positive patients are.
Okay, last question for you. Now, from Channel 6, now that you guys are posting recovery information, what are the chances for a reinfection for those who have recovered, and how do you know if someone is fully recovered?
So we don't have enough tests yet to test people and do a recovery test, but we do know that when people get sick, they start to show what we call seroconvert, and antibodies start to show anywhere from 11 to 15 days after they first experience illness. So that's one test of recovery. Bottom line, though, right now in lieu of tests, if you're symptom-free 7 days, fever-free 3 days in a row without the use of fever medication, then we are calling you recovered. We'll continue to track that. Those people who have recovered and their antibodies are really important to the future and coming up with treatment protocols down the road. So those individuals are really critical to the future and to what we're going to do with this as we look at how we can treat this.
Okay, thank you. Mayor. From Channel 8, some Oklahoma cities are now requiring residents to wear masks while in public. Do you anticipate a similar order happening in Tulsa? Or do you believe Tulsans are taking the stay-at-home order seriously enough that it's not needed?
I've visited with several of my colleagues, mayors from around the state of Oklahoma, just in the last day about that very question. At this point, I don't think it's necessary for us to include an order that people wear masks in public. People are certainly encouraged to do that, as you heard today from Dr. Dart, but we're not at this point considering that as something that's necessary to put in to a legally binding order. Our police officers have enough on their hands out in the field right now enforcing the orders we've put in place.
Okay, from Fox 23, even with the current moratorium on evictions, we have seen that 537 evictions have been filed. Is there anything being done to make sure we don't have a housing crisis after this?
So that's something that our team at the City of Tulsa has continued to monitor, in particular our housing policy director who works out of my office. The Tulsa County courts did, I think, an extraordinary thing early on in this process in halting their eviction docket to make it so it's not as easy for landlords to evict people in the midst of this. And of course, you've seen utilities step up, whether that's our own water service. We're not cutting off water service for people who can't pay in the midst of this. You see that with Oklahoma Natural Gas and PSO and AT&T and Cox. They're doing the same thing. I think it's unfortunate that there are some landlords who are still doing that on their own and doing it privately. But we're going to continue to try and identify ways that we can address overall long-term housing issues and make sure that people in Tulsa, in the midst of this, when we're telling people to shelter in place, that they have a home to do that in.
From Channel 8, more elected officials are now pressuring Governor Stitt to order a statewide stay-at-home order. Do you feel the same way? Does Oklahoma need stronger rules in place to slow the spread of the virus?
Any message I have for Governor Stitt, I'll convey that to him directly. I don't need to do that through the media.
Okay, from Channel 2, we are seeing in other parts of the country many folks who are getting sick and dying are African American and Hispanic and lower income communities. There is also a concern that these communities may be at a higher risk because they have more folks who are not employed in jobs that can be done from home. What specifically is Tulsa doing to make sure there is access to testing for these folks and that they have the proper health care if diagnosed?
Well, a couple of things. First, on access to testing, I think the expert to talk with or talk about that would be Dr. Dart. But I know that they have established a testing site for those who don't have a healthcare provider that they can get testing through. And so if you don't have a healthcare provider, one, you should contact 211 to get connected with one through our nonprofit community locally. But you can also contact the Tulsa Health Department to get connected with testing if you don't have a doctor that you can do that through. Now, I do think that the larger question just around those most impacted by this, I think you definitely see that not just here in Tulsa, but you see it all around the country. There are folks who work in industries that they don't have the option to stay home and shelter in place, that they have to continue to work. And I'm very mindful of that. It's one of the reasons why I think it's so important that everybody that does have the ability to shelter in place takes advantage of that, because you're helping those who can't, to make sure that they still have the healthcare resources should they catch this virus, to be able to get the help that they need as quickly as possible.
From Channel 6, any update on the city employees quarantined, and what about the police officer who has the virus?
So, yes, as of this morning, we had 52 city employees quarantined as a result of this virus. We've only had one city employee who has tested positive for it. I think he's on the rebound and doing much better, which is wonderful news. Everybody on our team at the city has really been pulling for him and is happy for that news. 18 of the 52 that I just mentioned are on their last day of quarantine, which is also excellent news. These are people, a lot of them first responders or other city employees who may have come into contact with someone who tested positive, and the health department's been so great about giving us a quick heads up anytime an episode like that has popped up. And now we've got 18 different city employees, almost over a third of all the employees that we have in quarantine will come out of it tomorrow, which means they've been able to go through it and not tested positive.
Okay, last question for you from KRMG. Mayor, we're seeing local convenience stores with all their doors open, apparently doing little to enforce any kind of social distancing. While people need gasoline, is it essential that they get inside to get donuts or coffee? Huge box stores are limiting people to one entrance and highly encouraging social distancing.
So, this is one of those things that we see it evolving just since we put this order in place, about a week and a half ago. Now you have larger stores like Walmart has really stepped up and put in place limitations on the number of people that can be in a store to try and encourage that social distancing. I know that other stores, Quick Trip would be a good example, they have limitations on the number of people that can be in a store. I think the real challenge is just the capacity of clerks within a store to actually regulate that. But I know that businesses are evolving with this and putting in practices that help protect their customers, which I think is a good thing. But I also encourage the customers that we all have to take responsibility for ourselves and be mindful of social distancing. And if you see a bunch of people in the store, especially in a smaller facility like you might see at a convenience store, don't go in. And so I don't have a single wave of the wand that can fix everything on this. One thing I would say, though, is that our officers continue to monitor businesses around town to make sure that they have safe practices in place. But a lot of the work that our officers have done on this, it's not showing up in citations. It's showing up in them meeting with business owners and pointing out what they need to be doing, and then those business owners complying, doing it voluntarily without us having to cite people or put people in jail. And we saw the exact same thing in the early phases of this when we were talking with restaurants and entertainment venues about the need to change the way they do business. And we've seen the same thing with groups of people over the last week and a half as well. So it's a continuing education process. And as I've said before, our officers in the field, they have the discretion and my authorization that if they feel like they need to cite somebody or even take somebody to jail, they have the ability to do that. But our officers to date have been using a lot of discretion and mostly focusing on education.
Okay, that's
Thank
it for
you.
you, sir. EMSA. This is our last question, and it's for EMSA.
Yes, ma'am.
Are you doing any special cleaning after every trip to the hospital?
Yes, we are. We're looking at new, quicker ways to do that, but each one of the medics are going through their trucks. Sometimes we'll have extra vehicles, extra helps at the various hospitals to help them clean their truck. And that's disinfecting everything from that could be touched, that was not sealed equipment-wise. Everything that's disposable is moved out. And that's after every call and continuing on.
Okay, thank you very much.
Thank you, ma'am.